Hello, so my name is Ana Sepulveda, and I'm going to be covering syphilis for y'all today. So, syphilis is a sexually transmitted disease or infection, and it is a negative gram bacterium, and it's caused by the bacterium Treponema pallidum. So over here on the side, you can see that this is the bacteria. It has a corkscrew-like shape, and well, it's more so coiled than corkscrewed. Well, they're the same, but anyway. Um, so but the proper name it's a tripona shaped, and over here in the bottom left corner is what's called a syphilic sore, um, but they're more known as kinkers, and this is a this is a round bump, and it's often red or a faded shade of red, and it appears on the skin. So going into the history of syphilis, um, it's been known to be called the Great Pretender, um, mostly because like it takes up characteristics of like other of other infections and other bacterial diseases. Um, the first known endemic of syphilis occurred in southwestern Asia at around 3000 BC. Um, it's due to the lower temperatures, and it kind of stayed around there. Um, yeah, it kind of stayed around there for a while. Um, not until um, not until we experienced trading and whatnot. So syphilis started to spread into Europe, um, more so by like the invasion of Naples by the French army. So over here on the side, there's a depiction of a man with syphilis. Um, so you'll see that he has the cankers all over his face, and all over the body as well. And yeah, so the famous gangster Al Capone, so they say that he supposedly died of neurosyphilis, and I'll explain that in another slide. After his imprisonment in Alcatraz, so he died of. I mean, they say that he died of neurosyphilis, because it was left untreated, and so he kind of started to like experience a lot of hallucinations. He, uh, they even said that he went through meningitis, and yeah. So the highest number of reported cases in U.S. history are at about 217,558, and that was in 1950. But as of 2021, the U.S. has reported 176,713 cases. So, transmission of syphilis. So, it spreads during vaginal, oral, or anal sex. You'll come in sexual contact with a canker or the or with the genital secretion that's already been infected with syphilis. Um, Usually, this is like on the penis, vagina, anus, or even on the mouth or lips. Um, so that's what we see here on the left side, that this person has a canker on the inside with their lips. Um, this also occurs with pregnant mothers. Um, that's known as congenital syphilis. So for pregnant mothers who get syphilis, it can pass on to their unborn child. In 2021, the number of cases of congenital syphilis had come about 3,000. I'm sorry, 2,377 cases, compared to 2012, when there are about 324 cases reported that year. So symptoms of syphilis in the primary stage, because there's 4 separate stages. So in the primary stage, that's when a single canker appears on the infection site. So the canker will last about 3 to 6 weeks. Even yeah, the canker will last there for 3 to 6 weeks, even after infection, and it'll stay there even after you get treated for it, because it'll go away. But even though you get treated for it, it's kind of difficult to notice because it's on your vagina or on the anus. And then the secondary stage, a person starts to like develop a non-itchy rash on their body. That'll usually occur. It'll spread around where the infection site was. So if you got infected, say like around your vagina, then it'll start to spread from your vagina. Then you'll have mucous membrane lesions. So those are the sores on the inside of your mouth, your vagina, or the anus. Other symptoms include fatigue, fever, swollen lymph nodes, and weight loss. And then between the second and tertiary stage, there's a latent stage. That's when there's like no visible signs of symptoms. So yeah, a person won't experience any of the symptoms, but the infection can still be present in their body. So if it goes untreated, then it can go into the tertiary stage. The tertiary stage is rare, and it can happen, and it happens in untreated infections that have already gone through the latent stage. So it appears 10 to 30 years after the primary infection was left untreated, and it can cause damage to your brain, nerves, eyes, blood vessels, liver, and bones. But yeah, but aside from these stages, you can develop neurosyphilis, autosyphilis, or ocular syphilis. So neurosyphilis affects your central nervous system. Some signs or symptoms include severe headaches, muscle weakness, paralysis, an altered mental status, meningitis, or dementia. So like I had mentioned before, this is what Al Capone had supposedly dealt with after his imprisonment in Alcatraz. Then you have autosyphilis, which affects your auditory or vestibular system. Signs or symptoms include hearing loss, dizziness, vertigo, balance difficulties, and tinnitus. And then you have ocular syphilis, which affects your visual symptoms. So signs and symptoms include eye pain or redness. You start to feel sensitive to light, or changes in vision, and in some cases you can even go blind. So yeah, you can see like with the images, this was the picture of a person who had neurosyphilis, and it had affected like the tissues it affected the tissues around the skull, causing it to deteriorate. And any of these types of syphilis can occur at any stage of infection during the stages. So treatment for syphilis. So there's penicillin, called benzathine penicillin G. So this dose of 2.4 million units. It's a single long-lasting dose that's usually given in primary, secondary, or early latent syphilis. Then the same type of penicillin, but this one is of 7.2 million units, And for this one, you take it's a total of 7.2 million units, but there are three separate doses of 2.4 million units that you take at weekly intervals. So for non-pregnant patients who are allergic to penicillin, just because a there are numbers of people who are allergic to penicillin, then you take doxycycline or tetracycline. And then for women who are pregnant, then you take penicillin G, and the dosage of this type of penicillin really depends on what stage of pregnancy you are. So how do you avoid getting syphilis? Um, so you just practice safe sex. Um, Try to abstain from it if you can. Um, but if you are actively, um, but if you are active, then you should be using condoms or dental dams. Dental dams should be used when participating in oral sex. Um, Anyone can get syphilis. There are higher numbers of it's more so common in men who have sex with men. Um, but that doesn't stop anyone from getting syphilis. Um, Make sure to get tested as well. Um, getting getting those getting STD screenings or STD tests are important for anyone who is sexually active. Um, Try to stay in a monogamous relationship, um, and make sure that your partner is also getting tested. And it's talking about partners. It's okay to talk to your partner about practicing safe sex. Um, because if you're mature enough to be having sex with your partner, then you're mature enough to have these types of conversations. Um, so yeah, that's the end of my presentation. So thank you.